Hi there, today I'm going to be talking about IBS or irritable bowel syndrome. Most people don't know that irritable bowel syndrome is actually the #2 cause of work lost in this country after viruses like the common cold and I guess COVID. It's such an important thing because it does affect quality of life, and in the past it's really been poo-pooed a lot by a lot of people, and I think it's really important to understand that it affects a lot of people's quality of life. So the simplest way and the way I talk to my patients about understanding irritable bowel is the lining of the gut looks normal, but it doesn't move the way that it's supposed to be. So sometimes it's moving too fast, sometimes it's moving too slow. That's when you have IBS constipation or IBS diarrhea. And then sometimes it's alternating between diarrhea and constipation. It's also characterized by abdominal pain along with these changes in bowels. And I think understanding how things are moving is really important in being able to manage this. When it comes to irritable bowel, one of the things that affects how things move are all the nerves that surround our gut. And all these nerves are affected by many things, including our mental state. So say you're under a lot of stress, things move too fast. There's urgency and people can get diarrhea. There are other causes like different bacteria. So there is some evidence now that certain bacteria cause irritable bowel with diarrhea. And we actually have medications to be able to treat that, antibiotics that can treat that. With IBS constipation, there is a methane producing bacteria that's been identified, but we don't yet have an antibiotic for that. Foods definitely affect irritable bowel. So if you eat things that are high in sugar, that brings a lot of water into the colon, and that can give you diarrhea. Fatty foods, creamy sauces, things like that, release certain hormones, and that makes the bowel spasm. And when there's a lot of spasm, the water can't get absorbed properly, and you get diarrhea. So patients will come in all the time saying, oh, I just have this urgency. I eat, and I have to run to the bathroom. And a lot of times it's when you go out to eat. At that time, you have to identify, are there sugars in those foods? Are they very processed? Is there a lot of fat or cream? So those are the things that can really affect how things are moving. What we eat is really, really important because it affects our gut microbiome, and that gut microbiome then affects how things are moving through our gut. So that's kind of a little bit basic explanation about what irritable bowel is. We'll slowly talk about, the different parts of it, like the constipation, diarrhea, things that can be used to help with that, including different kinds of foods that you can use.